Welcome to a place of wellness and healing for both your body and mind. Get ready to live a happy, healthy, energized life that totally rocks. You're listening to Straight Talking Natural Health, a no BS podcast for busy people who want to ditch the fatigue, find balance, and feel great, with your host and naturopath, Jules Galloway. Today's guest works with two health issues that affect a lot of women, except they don't know they have it. If you have them, they affect your quality of life in a big way. But you might have just been told you have weight gain, cellulite, or poor circulation. But many of these women actually have something called lymphedema or lipedema, and they are standalone health conditions that need a specific approach. Just losing weight does not work. So let's get the lowdown from a nutritionist who lives and breathes this topic and who has had amazing success helping women with these conditions all around the world. Please welcome to the show the very lovely Kimmi Katte. Woo! Welcome.
Thank you. Very excited to be here.
I know. And look, this is a really wild topic, I reckon, because it's one of those things where by the end of this, people are going to be like, oh my God, this could be me. But they didn't know until they actually hit play on this podcast, which is like fascinating.
Yeah, I think estimations, particularly around lipedema, are around 10 to 12% of women have lipedema. So estimations are like that's a lot of people. And as soon as you know what it looks like and what it sounds like, you can see people in a lot of places with it.
Oh my God, 10 to 12%. That's insane.
It is. Yes.
Wow. All right. Let's go for the big topic first. So, what is lipedema and what is lymphedema? And could we get like a little kind of a bit about what each one of those, like how they're different to each other?
Yeah. So, and that in itself is a little bit interesting about how they're different to each other, because some medical professionals are now suggesting or flat out saying that lipedema is on the spectrum of lymphedema. And so let's dig into what each of them are. So lipedema is actually a connective tissue disorder. It presents in very specific ways with some hypermobility. Usually people who have it have a strong dieting history, yo-yo dieting, binging, starvation diets. Usually they have some cortisol issues, have some dysbiosis. Lots of them have POTS. Later stages, people have joint problems and muscle deterioration. But one of the telltale signs, well, let's go through actually a lot of the telltale signs for lipedema. Disproportionate fat distribution in the body, not like the normal womanly shape, right? So there is like a normal womanly shape, right?
Yeah.
We have that.
The hourglass.
Yeah, that's right. We have it. We have extra fat distribution compared to men. But that's not what we're talking about here with lipedema. We're not just talking about bigger thighs, bigger butt than a man. We're talking about nodular fat below the surface of the skin on various parts of the body, mostly the extremities, so arms and legs, although it has been noted in other areas as well, many other areas actually, but it's palpable and nodular fat. There is a degree of edema in adipose tissue. So if there were to be some kind of edema scan, then that would show up to be positive, although that's also contested. Some people talk about, well, a lot of people actually talk about unexplained bruising with lipedema. They talk about painful or tender fat. They talk about heaviness in their limbs or wherever they've got their lipedema presenting. And some people also talk about a columnar shape to their legs. Like people will often use terms like tree trunk legs. And some people, depending on the type and the stage that they've got, may show up with some cuffing around the ankles and the wrists. And that it's almost like it looks like there's an elastic band and the tissue has grown over it. So it's almost like a definition. It looks like you've got, those little cute little babies that have like what look like the screw-on hands and feet.
Yes.
Yeah, it's adorable. So it's like that. Only, that's part of the staging that people, it's very upsetting for people to have that and to not know what it is, especially when they go to the doctor and the doctor just tells them that they need to eat less and move more.
Oh God.
Yeah,
Yeah. You just need to lose weight. Yeah.
that's it. Yeah, and this is how I want you to do it. But that doesn't work, obviously, because it's not a overeating, under exercising condition. So that's lipedema, very briefly. And lymphedema is some kind of disruption to the lymphatic system. So there is primary lymphedema, which is what I've got. I was born with several missing lymphatic vessels in my legs. And so my lymphatic system is compromised because of that. I still make the same amount of lymphatic fluid, but it just has a harder time clearing.
Yeah.
And there's also secondary lymphedema, which can happen as a result of some kind of trauma to the body. Most commonly, people know about secondary lymphedema as a result of a cancer treatment.
Yeah, especially breast cancer surgery.
Yep, any kind of cancer treatment, the surgery, so the removal of the lymph nodes and also radiation therapy as well is well known for producing some kind of secondary lymphedema.
Of course.
And
Yep.
that can be asymmetrical. So often it just presents in the limb that's closest to where the treatment happens. So if you have breast cancer or if you have breast cancer treatment, you're not going to get lymphedema in your leg. That's not how it works. You're probably going to show up with some lymphedema in your arm on the same side as you had your breast cancer treatment.
Yeah.
Yeah, so nutshells, right? That's both of those conditions in a nutshell.
Yeah.
Mm.
And they sound so similar to some really everyday things that people would just use to explain it away. Like, like you already mentioned, like you just need to lose weight. And the other one I'm thinking of is you've just got some cellulite. It's really normal for women to have cellulite. It's meant
Yep.
to look a little bit bumpy.
Yes, and also you've got a little fluid retention.
Oh,
Cut back,
yeah.
cut back on the salt. Drink more water. Use these diuretics, and that all those kinds of management strategies are contraindicated for both lymphedema and lipedema. Yeah.
Yeah. So how can you tell if you've got it? Because like it is so similar to these other things.
Mm.
How, like, are there any tests for each of these?
So I'll start with the easier one that has the yes answer. So for lymphedema, you can have lymphoscintigraphy, which is well, it's a lengthy stay in a machine that tests your uptake of radioactive substances that have been injected between your toes or your fingers, depending on where you've got your lymphedema. It
That
ain't
sounds
pleasant.
delightful.
It's no fun. It's no fun, but
No.
it's a good diagnostic tool. I've had two of those. And so that's a definitive diagnosis if you have a lymphoscintigraphy. There's also another scan called an indocyanine green scan where they inject a green dye into your lymphatic or in between your toes, and then it's collected up by the lymphatics, and that can show whether you've had some pooling, whether you have some pooling of your lymphatics. So there's that as well. I've had one of those too. That was probably the best money that I think I've ever thrown at my legs. I've thrown some serious amounts of money at my legs trying to figure out what's going on here. And I got a lot out of having that indocyanine green scan because it gave me some information that I could then use for management. And there's also a thing called a Stemmer's sign, which is if you can pinch the skin at the base of the toe or a finger, that's if your lymphedema is in one of those areas. If you can pinch the skin, then that's a negative stemmer sign, probably not likely that you've got lymphedema. If you can pinch the skin like relatively thinly. And so that's how you would test for. I think there's also the LDEX machine that a lot of physiotherapists use for assessment for lymphedema as well, but that works more efficiently, I think, if you're only comparing one affected limb to an unaffected limb. Yeah.
If you're born, like, you know how yours wasn't secondary, your lymphedema is something that you were born with. So does that affect both sides equally?
No. So for me, my lymphedema didn't present until I was, how old was I? 24. And so that's when my production of lymphatic fluid outran my capacity to manage it. And that's when the swelling all showed up for me. And I have lymphedema it looks like a sock shape on my right foot. And then on my left foot, it just looks like a little patch just below the base of my toes, according to the scans that I've had done. So it's not symmetrical. And it again depends very much on where it is, where the congestion is, and what caused it. There's a lot of factors that come into play with lymphedema.
Wow. All right. And then, so tests for lipedema.
Yeah. No, sadly.
Damn it.
I know it's only if I think it's in the works. I think there's been a gene identified in relation to lipedema, which is helpful, and there's going to be some progress on that information as time comes on, because that's just been a very recent discovery. But there is no test. You really need to see somebody for a clinical diagnosis, and somebody who knows about it. And lipedema is, even though it was identified, I think it was back in 1940 something, by some vascular doctors, it's not very well known. And in fact, it's only been just recently included in the International Classification of Diseases system. So the one that's being rolled out at the moment is International Classification of Diseases number 11. It's included in there, but prior to that, generally wasn't included. So it's newish. And if you go to the doctor and say, I think I might have lipedema, the doctor might say, oh, you mean lymphedema. Or might say, oh, you mean lipidemia. Or the doctor might say, do you mean lymphoma? There's lots of different things that they can guess at, because it's not commonly known. But your best option, if you feel as though you might have some of those symptoms, best option would be to try to find somebody who can diagnose you, which is tricky. There are a few GPs around. Vascular surgeons and vascular specialists see it a fair bit, but not all. And I'm just trying to think, and surgeons who perform liposuction, they often see it too, and they can not frequently diagnose it, but they can diagnose it or refer to somebody who could diagnose. But there's no definitive test, sadly, where you'll come out of a machine or get a piece of paper from a test that says, oh, definitely you have this. It's a clinical diagnosis. It needs eyes on. It mostly needs palpating. So it's tricky.
It really is. And it sounds like you can't just go to any old medical professional, because it's kind of hit and miss as to whether it's something that they've been trained in, and not just been trained in. I feel like it's one of those things where they need to have seen a fair few of them before they become really good at the diagnosis process.
I think so. And I think that's where it would be really good for the RACGP to get some training happening in the college for medical training, so that they can get a look at it and be able to diagnose it. I mean, the more readily it's diagnosed, the quicker you can get some help. The quicker you can get some help, the less likely it is to progress. And there are things, conservative things that you can do even while you're getting ready for surgery. If you decide to manage it with liposuction surgery, there are things that you can do to get ready for the surgery and make sure that your outcomes are better.
Yeah.
Mm.
So you were saying, you would want to stop it from progressing, like what, and I think earlier you mentioned like it can progress into quite an inflammatory, degenerative situation. Like what happens?
So in the early stages, women notice that their thighs are thicker than their friends. Actually, and what I might do is peel back to the times in a woman's life where it might be more noticeable. And it's during the times where there is some hormonal surging, so puberty, pregnancy, menopause, and our good old friend stress.
Damn it, you
Damn it,
again.
I know.
Hello, friend. Hello, old friend.
Shows up everywhere. And of course, during those periods in time as well, they feel a lot more stressful, right? So it's hard to pull it all apart. Hopefully one day it'll be a lot easier when we have some more information about it. But so they're the times in life. So a girl who has lipedema, it might show up first time during puberty, and she might notice that while her other friends are also going through puberty and developing that womanly shape, that her shape might be just a little bit more extreme and a little bit more disproportionate to her friends, trying to keep in mind that perfectionism is not what we're shooting for, and we're not shooting for a boy's body or a boy's shape. But there is a difference. There's a marked difference during that time. So that might be the first time a person notices. And then another time pregnancy, another time menopause. So when it first shows up, it can show up with some pain in the tissues. And people call it, like people say that even if a kitten were to walk on, or even something just brush past their leg, it's so painful. They can't have massages on their legs because it's excruciating for a lot of people. And that's because of the edema pressing against the nerves and the inflamed fat. The adipose tissue becomes very inflamed. But even in early stages, it can still be painful, and that can be a differentiating factor. Easy bruising as well. I mean, or easy or unexplained bruising, that can happen. There's a lot of roads towards that, right? So it's really hard to pull all that apart. But combined with everything else, they can be some factors to consider, maybe taking a young person to somebody who doesn't know how to diagnose lipedema and getting that looked into.
Yeah.
Yeah.
Oh, goodness. Okay.
Yeah.
It just makes me think, like when you're rolling through all that, I'm just thinking, this is so common, but it's obviously that it's a spectrum itself. And so that you're going to see degrees of it depending on, I guess, people's hormones and their stress levels and their diets and whatnot. But
yeah,
holy moly, like that, it could be so many people.
Yeah, and I think when I describe it to people, most people's eyes start to wander into that, oh, I remember that person point in their lives, or I've seen that cuffing situation, or that really disproportionate. Sometimes what happens is people, when they go on, in the early stages, when they go on low calorie diets or those starvation diets, and they do lose weight, but they'll often find they can only lose weight above the waist, and they become what's described as skeletal above the waist. but very, we call it lippy below the waist. So it's almost like you've got two halves of different bodies, but you've tried to join them together, and that you know with your eyes something doesn't seem right here.
Yeah.
And that's one of the ways of helping to manage this condition, or particularly lipedema, is to make sure that people are eating enough food to support a robust metabolism, so that any part of their adipose tissue that is relatively unaffected by the lipedema can be impacted by the robustness of their metabolic rate, which is driven down by excessive dieting, low-calorie dieting, yo-yo dieting, starvation diets, all those things that we use to drive down weight.
Oh my God.
Mm.
Yeah. So it's like, oh, by the very nature of it, like people are going to go away and do all of those things because that's the first thing you would think of when
Yeah,
you
and
see like an area of the body that you want to be smaller.
yeah, and you know, as a nutritionist, my hardest job in working with women with lipedema is getting them to eat enough food.
Yeah.
It's the hardest, and I've said this over and over again, it's the hardest work that I have, and I have to say it a lot of times, because it's that important to eat enough food to support the metabolism, and to eat enough of the right kinds of foods, you know, foods that aren't going to inflame the body and exacerbate those pathways that are involved with lipedema as well. So it's very, it's tormenting mentally, because
Yes.
we have this information from our doctors, our neighbors, our families that say, oh, stop eating so much.
Yeah.
But, but you're barely eating anything at all. Like you're on the ice cube and a bit of dust diet, still gaining weight. And it's because you've got these mechanisms of lipedema that are progressing, and the weakening of your metabolic rate, hand in hand, are going to affect the way your body shows up for you in the world.
And if this is a connective tissue disorder, does that mean that we need to be consuming the right amount of nutrients to feed the connective tissue so that we're actually creating healthier connective tissue in the long run?
It's hard to know, to be honest. There's a lot of questions over that. A lot of people say, well, we need to be eating a lot of collagen rich foods.
Yeah, vitamin
Yeah,
C to make the collagen. Yeah, all the
yeah,
things.
all that stuff. And it is really hard to know. There's not enough information about that to say definitively we need more collagen in our mouths to do that. So as far as hypermobility is a very common comorbidity with lipedema. My favorite way of managing that, or encouraging people to manage that, is to get into some very careful strength training, to help manage their hypermobility. And when I say careful, I mean, you know, using an exercise physiologist who is familiar with hypermobility, and so you can do it in a safe way. But I'm not convinced on eating a lot of collagen to help the hypermobility part of it.
Yeah.
Mm.
So let's just backtrack a little bit. What are the causes of lipedema? Like you mentioned a gene before, so I'm going to assume that it runs in families, and you've also mentioned hormones a lot, but what else is going on in this picture?
So, yeah, genetic hormones certainly play a part. And how heavy, I mean, I don't think that you can, oh, you know what, there's so little that we know about this condition because it's so new. I think I'm aware of pathways that can exacerbate a person with lipedema more than I am about the causative factors. So it's likely genetic, because but you know what? You know what else is food intake is not genetic, but, you know, familial, right?
Inherited, yeah.
Yes, that's right. So
It's like how people say that about diabetes too. They're
yep,
like, oh, my mum had it, her
yep,
mum had it. It's like, yeah, did you all eat the same diet?
that's
Yeah.
it. That's it. But I don't think that diet causes it. I do think that there are a lot of dietary patterns that can exacerbate it. And I think that's what we need to focus on right now until we find more causative, or until we find, I'm not going to find any, but until those
Oh,
lovely
come on, mate. You've got all that time on your hands, haven't
ah,
you?
no, it's not going to happen. But I honestly think for me, my work is focusing on what seems to exacerbate it. I'm waiting patiently for all the sciencey people to find out the causative stuff, and then we'll have a lot more information to work with. But exacerbation of it, definitely, I think it's exacerbated by under eating, all the strong dieting history, and very high carbohydrate diets and nutrient poor diets, I think are terrible for lipedema, and also our old friend stress.
Damn it.
I know, I don't even know, but part of a treatment plan for a person with lipedema is going to be stress mitigation strategies, which I'm yet to master myself, stressy girl that I am. But I am all for every single thing that you can try to help put a buffer between the impact that your stress hormones are, between your body and the impact that the stress hormones are having on it.
So what happens like I guess we don't know yet, but you get stressed, your cortisol goes up.
Yeah.
Why does that lead to an exacerbation of symptoms with the lipedema?
Yeah, I think it's got to do with insulin. So what I have noticed, I run bloods I won't work with anybody unless I see bloods, just because I prefer to test rather than guess. I just like it that way. Often what I find is that women with not all women, there are outliers, and there's no doubt somebody will listen to this and say, that's not what had happened with me. That's okay. But for the most part, we have great glucose control, really great blood glucose levels, but we are insulin resistant, or producing a lot of insulin for the amount of blood glucose that we've got. So we're not looking at diabetes, we're looking at hyperinsulinemia. Yeah. And I think that I think that's fueled by cortisol, whether it's high or whether it's low. I don't always test cortisol, but whenever I have on a woman with lipedema, it's usually off kilter. Although tested somebody last week and it was beautiful. So
there's always one.
Yeah, there's going to be outliers, and that's okay as well. It's just that there are some pretty significant patterns that I've seen. And the other factor that's always tied in with this is extreme levels of leptin. So leptin's something that I usually order as well for a person who has a diagnosis of lipedema, and those higher levels of leptin tied in with stress and stressful lifestyle, because much of leptin sensitivity, improving leptin sensitivity, there's some dietary things that we can do, but it's mostly lifestyle, right? Good waking up routines, good getting ready for bed routines, good light exposure, eating 3 meals a day, not having coffee as soon as you wake up in the morning. All of those factors can help to normalize your leptin as well. Yes, so stress, a massive part of management.
Yeah.
Oh,
and I was just thinking about all those shift workers out there whose leptin's off the wazoo.
Yes. Yeah. And I'm not saying everybody who has increased or leptin if everybody who has leptin resistance has lipedema, but it's like more than 90% of people that I test, and I almost exclusively work with women with lipedema and or lymphedema, and more than 90%. So there's a pretty solid stat, right?
Yeah.
Yeah.
Hey, do these conditions only affect women? Because we haven't mentioned
Mm.
any men whatsoever.
Yeah, so lymphedema, there's lots of men with lymphedema, simply because lots of men are also treated, was secondary treated for cancer, and so they also can develop lymphedema. And again, with primary kinds of lymphedema, it can affect men and women. Lipedema, it tends to affect women more than men, but there are men who have it. I've not treated any men with it, but and you know what, this is really interesting. If I did, my first step would be towards a Dutch test.
Yeah,
Right?
hormones.
Yeah.
Yep, 100%.
Yeah, but having said that, I've done a lot of Dutch tests on women with lipedema, and there ain't no pattern.
I was going to ask about that. Like, is it like that there's too much estrogen or not
No,
enough progesterone, or is it?
no, there's no pattern. The only pattern I see in a Dutch for women with lipedema is cortisol.
Right.
I know it would be. I was thinking I am going to be the person who figures out what it is. It's going to be one of these metabolites. I know it, but no, I haven't been able to identify a significant pattern. And I know there's lots of eyes on hormones for lipedema as far as just discussion points around it because of the periods in a woman's life where there seems to be the surging and the progression.
Yeah, that's why I was wondering, because you were like puberty,
I know,
perimenopause. I'm like, cool. Which hormone is the
right?
culprit?
Yeah, no, haven't. It's not a thing. It's not a
Damn
thing.
it.
I've even like I run a Dutch on myself every year. This is one great thing about having both these conditions. All the tests I'm doing.
Yeah.
No, there's no pattern that I've been able to establish, and I am looking. It's a terrible. It's not a great control way of doing research. Because I'm looking for it. But
You're slightly biased. N equals 1 study is flawed, are you
that,
saying?
yeah, something like that. Yeah, but it's really. It would have been wonderful if that were the case, but it's not the case. I do think that there are, if there are some hormonal issues, that some of the symptoms of lipedema can be modified by treating those variances.
Mm.
But I can't see a causative. I can't see, oh yes, when somebody presents with this and this and this on their Dutch, that's lipedema. Can't recognize it.
Interesting. The plot thickens, huh?
I know.
Mm.
No. Mm.
Well, okay, I think we've ascertained that we don't know everything there is to know about what
Yeah,
causes this or what's driving this, but you've got some pretty good ideas around how we can manage it.
I do.
Yes.
Yeah.
So, did you want to go through like the medical treatment versus what you would do or how you complement it? Because like so if they went to a doctor,
Mm-hmm.
what would be the likely course of action?
The likely course of action, if they went to a doctor who doesn't know about lipedema, would be to put them on a very low calorie diet and get them killing themselves in the gym.
Rightio. So they're going to end up on your doorstep.
Right. The other thing that a doctor might do, especially at the moment, I don't know if you've heard of those medications, Ozempic.
Oh, don't even start me.
I know.
No,
I
it's
know.
not. I'm not going to say too much. I don't want to get shot, but
I'm the same.
it's not my favorite right now.
Not my
I'm
favorite.
seeing a lot of people on it,
Yeah.
and I'm not hearing. I guess if it was doing wonderful things, those people wouldn't be at the naturopath or nutritionist in the first place. So again, I'm getting a biased sample population, but geez,
Right.
the people I'm seeing on it are not happy.
Yeah, it's so some people are happy in the
Mm.
lipedema community who are taking those, using those injectables. They're happy.
Mm.
My big problem with them is that they drive down the appetite. And something I talked about. I did a little webinar for one of the surgeons who sends his patients to me before surgery to get them ready, and did that last week. And one of the things that I mentioned was a lot of people who have lipedema have a very poor appetite. It's hard to know whether it comes along with the condition or whether they've driven it into the toilet with undereating. And then the metabolism just keeps getting underneath of it. But when a puppy or a child or an elderly person loses their appetite, that's when you worry, right?
Mm. Absolutely.
Yeah, you worry. And but a person who has lipedema, when they have a low appetite, people go good. And that makes me cry and angry at the same time. Like, what is it? Crangry. Um, it it infuriates me, and that's my huge problem with those injectables. Um, I would much rather naturally and gradually build up a person's appetite so that they can support and build a healthy metabolism, a robust metabolism. I love that terminology.
Mm.
Um, so that they have a good appetite. They can eat a decent plate of food for them as a human, not eat like a bird, eat like a woman, for God's sake, and and
I like
stop.
that. Eat
Yeah,
like a woman.
yes, and stop under eating because it's undermining you. That's my biggest problem, aside from the gastrointestinal side effects, and
Oh,
long term, we're not really sure what that's going to roll out towards. But yeah, I'm not a fan. But that's something also that a doctor might do.
yeah.
And
I think that's why I've got a biased opinion of
mm,
that particular drug, is because I think I'm copying the ones who got the gastrointestinal side effects. That's why everyone who had a good run on it doesn't end up on my doorstep.
yeah.
But does it in your community, the people who do use those injectables, like, does it at least help to like stabilize the blood sugar part of this picture?
The blood sugar is already stable. This is the problem. And so with those injectables, it's driving the blood sugar down.
Mm.
And so what we're seeing is people with hypoglycemia, and they have to have that drug in their system for however, it's normally a week, right?
Mm.
And so they have to, if they have stable blood sugar and then they use this injectable and it drops their blood sugar, because I don't know whether this is happening or not. I'm not sure whether doctors are testing a patient's blood sugar before they prescribe these medications.
Mm. In a perfect world, yes, but in reality, not always.
Maybe not. Yeah.
Yeah, I think I've already seen one example where that wasn't done.
Right.
So
Yeah.
yeah, but
So
I
that
would
disturbs
assume
me.
many doctors do, though,
Yeah.
because there's lots of people doing the right thing as
Yeah.
well.
Yeah. That's right. That's right.
Mm.
But in my community, because our blood glucose is mostly stable, when they take those injectables, it then becomes too low, and then they have those low blood glucose uh,
Mm.
symptoms, and it's actually low even when they test it. So then they have to start eating, or they feel as though they have to start eating high sugar foods which exacerbates the condition.
Oh dear.
Yeah. So I'm not a fan
Sorry.
of those things. But if you were to go to a doctor who does know about lipedema, then what might happen is they might send that person for a clinical diagnosis to a vascular doctor, a surgeon who manages lipedema with surgery. That's another way of managing it. Or they might send them to somebody like me or any of the nutritionists who are across this condition.
Right.
Mm.
Oh, we're going to need more nutritionists.
Yeah, well, there are a few of us. It's lovely, actually. There's a few of us in this field, and interestingly, most of us who work in this field also have the condition. So having that first-hand experience is really helpful because you can have some empathy. Yeah, which I think people with lipedema resonate with.
Yeah.
Yeah.
So
Mm.
when they land on your doorstep,
Mm.
what do you do with them?
So I should speak in broad strokes first. So I like to assess what they're eating and roughly how much they're eating, because as I mentioned, a big target is helping them to eat enough food. So getting started on that is the most important thing, building up their metabolism again. And also the kinds of foods that they're eating as well. A lot of people with lipedema, because they've been such strong dieters, they will frequently go for the low calories rather than the nutrient dense foods. And so they'll often come with some nutritional deficiencies. Not often, it's always with some nutritional deficiencies. So I like to assess everything first. And then when it comes to treatment, generally speaking, and when I say generally, I mean almost always, it's going to be some variation on a lower carbohydrate diet. And it might even go all the way to a ketogenic diet. I started using a ketogenic diet for my lymphedema well before I started using it for my lipedema, because I was diagnosed with lymphedema well before I was diagnosed with lipedema. And so I've found that some variation between low carb and going all the way and getting into ketosis, producing ketones for yourself, is a really great strategy for somebody with lipedema and or lymphedema. But it's an attention to the quality of the foods as well. And
Yeah, not just bacon and cheese and bulletproof coffee. Is that not
yeah,
what you're
no,
talking about?
no, not what I'm talking about. Not what I'm talking about.
Damn it.
No, yeah,
You're no fun.
I know. I'm a big fan of whole foods as unprocessed as possible, and the calming of the nervous system. Tell me when you figure that one out. But coffee first thing in the morning, that bulletproof coffee thing, I think has done a lot of damage to a lot of nervous systems around the world, to be fair. I'm not a fan, but I do like people to, as I said, eat real whole foods. I don't like the whole eat these bars and eat these soups and out of a packet that can be reconstituted and keep your calories low. I'm not into the low calorie, low carb and ketogenic diets. I like people to be on a whole food keto, whole food low carb. And I love it if people will, I've got a couple of really good food lists. One of them, people will get on there, if they sign up for my newsletter on my website, they get a free food list, a keto food list, and information about electrolytes, which is like so important on a ketogenic diet. Those people who are trying to do a low sodium version of keto as well, they're just going to hate themselves and hate the world, and their adrenal glands are going to tank. So, so it's so important to pay attention to those kinds of things as well. But some people will just say, I'm doing keto, but I'm getting nowhere. But I will say, like, what we'll do is determine what kind of keto. And usually people are doing a dirty version of a low carbohydrate diet rather than a ketogenic diet.
A dirty version.
Yeah, filthy dirty, filthy dirty.
So it kind of sounds like it's not just a keto diet, it's almost like an anti-inflammatory
Very
keto
much.
diet.
Yeah, very much. One of the drivers of lipedema is inflammation
Yeah.
and
And
fibrosis.
lymphedema for
Yes,
sure. Yeah.
absolutely. Both of those. And a lot of the targets for lymphedema and lipedema can be managed really well with the production of ketones because they're such potent little anti-inflammatory molecules. And like, I've helped a lot of people with lipedema and lymphedema, and a lot of people are changing their legs, which they've never been able to do, which is really exciting. Um, really exciting. And whereas I do prefer the ketogenic diet for myself, sometimes I'll put a person on a low carb diet, depending on how their bloods show up, their health history. It's all, a bit individualized. Um, it depends on some factors, but often if a person will just adjust their food choices and do nothing else, that can improve their symptoms.
Are there any other things that people can do alongside the diet to improve the outcomes? Like, do you do supplements, for example?
The only supplement that I always prescribe for a person with lipedema is, and actually lymphedema as well, is magnesium. Targets a lot of the pathways for both of those conditions, but rest of the supplements are, as you know, individualized and need to be done in like therapeutic dosages. There's not one aside from magnesium that I prescribe to everybody. Quercetin is a nice one, but not for everyone. And I quite like tocotrienols as well, but again, not for everyone. So it just depends on how they show up in the world, what their body's showing up like, and also what else they've got going on with their other, I'd say, higher priority nutrients like zinc, B12, folate. They're they're the usual culprits that I see
Yeah.
in women with lipedema.
Yeah. But like you said, sometimes people will end up with multiple nutrient deficiencies because they've just been dieting and
Yep,
eating the wrong foods for them over a number of years.
it's true,
Yeah.
true.
Now, if someone says, "Oh, look, that sounds great, but I'm already booked in with the surgeon,"
Yeah.
I know that you do some amazing work alongside surgeons to
Mm,
improve outcomes. So tell
mm.
me why that person would also want to do nutritional treatment alongside the surgery.
Yeah. So when you're going to get ready for a surgery, what you want your best outcome, and the surgeon wants the best outcome because everyone's happy then, right? Um,
Everybody wins.
that's it, win-win. Um, and so if your inflammation is under control and you've managed to get your the fat in your legs or your arms, wherever you're having your surgery, nice and soft, it makes the job of the surgeon a lot easier. And it makes your recovery a lot easier. A lot of people forget about the recovery with surgery like this. And and so preparation for surgery, it doesn't matter what kind of surgery you're going to have, it's really important to prepare and to prepare for the afterwards as well. So one surgeon that I've been working with quite closely up in Queensland, Dr. Chris Lekich, I've uh, helped with managing the menu at the hospital, which is great. So they now have meals that they can choose that are anti-inflammatory, but and when I say anti-inflammatory, it leaves out inflammatory ingredients, um, and provides enough of the nutrients in good ratios so that they're supporting their recovery after their surgery. And I've also developed a little pre-surgery pack for people who are using a ketogenic diet and how they would want to modify that going into surgery. I don't like any of my patients going into surgery with ketones in their blood. I much prefer them to be out of ketosis for that, so that when they go into surgery and they experience the blood loss that happens with liposuction, they have a much easier time of retaining their minerals, because when you're in ketosis, sodium retention is hard, and you need your sodium. You need your sodium when you've got blood loss.
Yeah.
Super important.
Wow, so much to think about.
Yeah. Yeah.
That's amazing though, like that you are working with surgeons and actually like collaborating, not just sort of as in like not just working around them, but working with them. Like this is really awesome for both our industries.
It's exciting, and yeah, super exciting. I feel really honored and privileged to be able to help the community that I help, but also just really honored and privileged that I'm collaborating with somebody, or people, lots of people in this industry who care about the community, giving a shit about people rather than just saying, eat less, move more, and sending them off to perhaps a bariatric surgeon. I'm not a fan.
Oh God.
Not a
No.
fan.
So yeah, hats off to these surgeons who are actually thinking outside the square and going, okay, like,
Yeah.
yeah, let's see what we can do.
Yeah,
It's
yeah. It's
awesome.
really nice. It's yeah, honored and privileged.
Yep.
Mm.
Warm, fuzzy feeling. This is good.
Yeah,
This
yeah,
is what it's meant to be like. This is what we've
yeah,
always wanted.
yeah. Helping the people.
Yeah, no us and them. Let's just all find a job we can do that will help everyone's outcomes to be better.
Yep, 100%.
Yeah. So tell me a little bit about your offerings and how people can work with you. Like tell people how they can, show up with you online and get these better outcomes.
Yeah, so people can just take a look at my website if they want to see what I do, which is www.kimmikatte.com. So I've got all of my offerings on there. People can follow me on Instagram at Kimmi Katte _nutrition_lipedema. And on Facebook, I'm Kimmi Katte Nutritional Synergy. I run 8-week classes for women with lipedema and lymphedema to help them unfold a ketogenic diet. Lots of hand holding in that one. I've made a do-it-yourself program where it's self-paced for people who don't want the hand holding. It's keto for lipedema and lymphedema. It's also on my website. I've made that surgical protocol that I mentioned on the website as well. And people can also see me for nutritional medicine, which is very individualized. That's where I do the blood work and write up individualized treatment plans for people. But by far the most economical way of having access to me for 56 days in a row is that 8-week program. We've taken almost 1,000 women through there. Yeah, it's a fantastic program.
Amazing. Honestly, I feel like this is the sort of thing where people need support and need a little crew around them of people who understand what they're going through. Like that, like, it would be tempting to just go, oh, I'll just go off and do a keto diet on my own. But no, there's like, I really feel like they would benefit from the complete package and having that community around them.
I think they do. And that's what people say. We're in the middle of one at the moment. We're just past the halfway point in our latest 8-week program. And we get people to do their measurements again at this point. And people, even at 4 weeks, in 1 month, people are changing their legs. It's such exciting work. Every day I get to say, I love my job every day. It gives me goosebumps when I read those little testimonials and they put their measurements down and they say, I cannot believe, what is this sorcery? Someone said actually just last week, what is this sorcery? So super exciting and really privileged to be able to help people. I feel as though I've become the practitioner that I was looking for when I was first diagnosed. That's what I feel like.
Yeah, then you're the perfect person to be leading us through this.
Feels
That's
good.
so awesome. Thank
Mm.
you so much, Kimmi, for everything you do in this space and for being a bit of a trailblazer in this niche. And I'm looking forward to a couple of years from now when we get you back on the podcast and you tell us all the latest research and developments that you've come across since we spoke last.
So exciting. Fingers crossed for all of that.
Yeah, fingers crossed. Thank you so much for sharing your knowledge with us today.
Thanks, Jules.
I hope you enjoyed listening to Straight Talking Natural Health. If you liked what you heard, make sure you hit subscribe so that you're the first to know when new episodes drop. In the meantime, head over to my website at julesgalloway.com. There's all kinds of resources available there if you're keen to get started to live your best, healthiest, most energized life. When I'm not podcasting, I'm seeing clients one-on-one via Zoom, so why not book in and let's work together? I love helping my clients to heal from fatigue, anxiety, inflammation, gut problems, and chronic health issues, to name just a few. All of this and more is available right now over at julesgalloway.com. That's all from me for the time being. I look forward to diving in with you again in the next episode. Bye for now.